welcome to St Luke's. Thanks to Eastern Health for providing this as a venue for what will be a significant announcement from our federal colleagues. So I'd like to acknowledge the panel here. We have Minister Patty Hajdu, Federal Minister of Health, and the MP for Thunder Bay Superior. Virtually, we will have the Honourable Deb Schulte, Minister for Seniors. Behind me to my right, we have our local member of the Federal Cabinet, the Honourable Seamus O'Regan, Minister of Natural Resources, and to my left, none other than the Honourable Andrew Furey, Premier of Newfoundland and Labrador. I am not going to occupy the podium for very long, but I would like to introduce my colleague and my friend. We've had quite a lot of chats over the course of the last 18 months, I think more than I have had with any previous federal health minister, and we have a great friend in Ottawa and someone who has done a stellar job leading the federal initiatives through COVID-19. And I think if we can say anything about Newfoundland and Labrador, we have been very successful with COVID-19, but we would not have been able to do it without the incredible support and assistance from Minister Hajdu and her team. So I'd like to take this opportunity in public to personally thank her and call her to the podium. Patty, it's all yours.
And thank you very much, Dr. Haggie. And indeed, he has become a friend. You know, it's been helpful to have Dr. Haggie's expertise and medical background. And I can't tell you the number of times that I texted him or called him to say, what do you think? Can I pick your brain? And I have to say, you have an incredible Minister of Health here leading this province. Premier Furey, it's wonderful to be with you. I'd only heard great things about Premier Furey until yesterday when I had a chance to actually sit down and meet with him myself, and he generously gave me some time on a provincial holiday to share with me his thoughts about now and the future, COVID, and all things health in Newfoundland. And I think we share a lot of common perspectives on the need to reinvest in health and the need to keep people safe and healthy in their communities. And so thank you, Premier Furey, for your leadership. And of course, my dear friend, no words really, for the Honourable Seamus O'Regan. I had the pleasure of meeting Seamus when we were both elected in 2015. And up until COVID, we were seatmates in the House of Commons. And, you know, Seamus brings a certain passion to everything he does. Everything he does. And he never forgets to remind people about the importance of Newfoundland and this part of the world here in Canada. And so I just want to thank Seamus for the incredible friendship. He's been there for me. It's been a hard year for everyone. And Seamus has never hesitated to give me a shoulder, a kick in the butt if I need one, whatever it takes to keep me going. So thank you, Seamus. And it is a joy to be here with you today on the traditional territory of the Beothuk, and the island of Newfoundland as the ancestral homelands of the Mi'kmaq and the Beothuk. And also, I'd like to recognize that we're also here in the territory of the Inuit of the Nunatsiavut and the Nunatkuvut and the Innu Nation. And I come from Thunder Bay, Ontario, which is just on the tip of Lake Superior. The traditional territory I come from is the Anishinaabe of the Robinson Superior Treaty Area, and many Métis people made their home there as well. And so I've started telling people in these acknowledgements where I come from, because I see the elders do that. So I think it's important when we're talking to know who we are and where we come from. Okay. Je veux vous remercier d'être ici avec nous aujourd'hui. Après une longue année et demie de pandémie, c'est un plaisir d'être avec vous en person pour cette annonce. And I can't tell you how much I've enjoyed getting out of my Zoom room. I don't know how many people have been locked in a little room in their house working day and night in front of a screen. But when I was fully vaccinated and the restrictions were lifted for Ontario, and I was able to emerge from that room and start to see people, what a feeling to see community. What a feeling to be able to meet with colleagues. What a feeling to see family again. And that's the year it's been, the year and a half it's been, friends. People have been separated, but with vaccination rates growing every day and with the protection that is keeping us increasingly safe, we are starting to live our lives again and see each other again and be reminded about how important those connections are. And today I visited the incredible vaccine clinic that you have here in this community, met with those hardworking nurses and healthcare workers, some of whom have come out of retirement. The place was full and bustling. The energy was incredible. People were lining up to get vaccinated. We talked to some of the people, and it was about their kids. It was about making sure we kept our school years intact. It was about protecting themselves and their loved ones and their family. It was about making sure the small businesses can continue that growth and stay open in the year to come. So people were looking out for each other, and that is truly the Canadian way. And it's been the way throughout this entire pandemic, people looking out for each other. But there has been tragedy, and we can't ever forget the tragedy that we saw in long-term care across this country. And the wise stewardship of your government here, you did not see the same kinds of death and dismay that so many long-term care homes faced, so many families faced in the waves of COVID-19. And I can tell you in Ontario, where I come from, it was tragic. In my own community, we lost 19 lives in 1 month. And that was from COVID-19 sweeping through long-term care homes, some of them that lost staff were sick, there were people without the appropriate training, without the appropriate equipment, and it was a tragedy. And we can never forget that, and we have to do better for the people who are so vulnerable in our communities and their families. Many people face long periods of isolation, and I'm here today, I'm sure, with people that know that those elderly folks, their joy comes from seeing family. That is their joy. That is their purpose. And so many families struggled with that separation. So many seniors died not just of COVID, but of heartbreak, of neglect, and of care that just wasn't adequate. And that's why this federal government decided to step into the space of long-term care and decided to say, how can we work better as a country? So that if people do need support aging and they can't age at home and they need the help of a long-term care facility, no matter where they live in this country, they will be safe and they will age in dignity. And that's why that commitment of the Prime Minister was made during those waves. You know, we didn't wait, of course. We addressed some of those immediate and urgent needs. And the Canadian military, I'll never be more grateful than I was when the Canadian military went into those long-term care homes. And Seamus and I were at the table when the Minister of Defense, Harjit Sajjan, said, we'll get people there. And they got people there and they trained people. And the military went in and they bathed people and they held their hands and they comforted people and they fed people and they cared for people and they nursed people. That's what Canadians do. They step up and they help each other. We also provided, without question, the money, wages top-ups, the personal protective equipment. We bought it, we distributed it, we didn't charge. Because that's not what Canadians do. We don't tally up the bill in the middle of the crisis. We just step in. And the federal government knew that we would do whatever we needed to do for as long as it took to protect as many people as possible. And so as we started to plan for the future, Deb Schulte, who's here, Deb and I, we're tasked with creating a new fund and a new way to support provinces and territories to deliver on their responsibilities in long-term care. And we created the Safe Long-Term Care Fund announced in the 2020 Fall Economic Statement. And I do want to take a moment to thank Deb personally, because as the Federal Minister of Seniors, and I can't really see you, Deb, it's really sunny, but I can almost see your outline there. Deb is also, in her former life, an engineer. So anybody who knows engineers knows that they're incredibly detailed and incredibly precise. And Deb held our officials to account every single day to get it right. And I was so grateful to work with someone like Deb to make sure that what we put together was going to be useful to provinces and territories, but also have the rigor that would make the difference for the families that were depending on us getting it right way into the future. And so today I'm very excited to say that we've signed our first agreement under this new Safe Long-Term Care Fund with the province of Newfoundland and Labrador. And I want to thank the province for stepping up and being the first partner. And for the residents of this province, that means that about $15 million more will flow into the province to support long-term care priorities. And of course, it's done in a way that's flexible so that the provinces and territories can indeed put that money where they know it's going to be needed the most, whether it's improving ventilation or the facilities themselves that were often overcrowded. And I'm going to let the Premier speak in a moment about what some of those priorities are. I think as Canadians, we've come through some really tough times together. I have no doubt there'll be more tough times for Canadians. But I can't tell you how in love with this country I am, and how in love I am with Canadians who never ever stop caring about each other. And this commitment today is about making sure that we continue that commitment to each other, and especially to those people who need us to be there like they've been for us our whole lives. Thank you very much.
Thank you, Patty. Minister Hajdu. It is indeed another evidence of welcome support from our federal colleagues. We have also virtually on the screen, a bit difficult to see for some in the sunlight, Minister, the Honourable Deb Schulte, who is the Minister for Seniors. Our seniors are part of our heritage in this province, and we have worked hard to keep them safe. And everybody here has done their part too. And I think, again, it's that partnership between health, healthy living and seniors that will see us through whatever comes next. So I'd like to turn it over to Minister Schulte to say a few words. Thank you very much.
Thank you very much. And hello, bonjour à tous. It is an incredible pleasure to be here with Minister Hajdu, Minister O'Regan, Premier Furey, and Mr. Haggie for this important announcement, although I am here virtually. It is a great day for seniors in Newfoundland and Labrador. And I have to say personally how grateful I am to have had the opportunity to work so closely with Minister Hajdu. It's a real privilege to be working with you. You have touched every file when it comes to do with health, and obviously health through this pandemic has been shown to be at the center of so much. Making sure that everybody stays healthy is the key for a good economy, for health and well-being. And you have been right there, Patty, on every single thing that we've had to do as a government to make sure that we keep Canadians safe and we get through this pandemic. And it's been an honor and a privilege to work with you, as too with Minister O'Regan. Before I begin, I'd like to acknowledge that I'm speaking with you virtually from Rocky Harbour, which is located on the ancestral homelands of the Beothuk, and also that the island of Newfoundland is the ancestral homeland of the Mi'kmaq and the Beothuk. Following in the tradition of what Patty just did, I think I should as well. I am from Vaughan. I represent Vaughan in Ontario. And Vaughan is situated in the Territory and Treaty 13 lands of the Mississaugas of the Credit First Nation. We also recognize the traditional territory of the Huron-Wendat and the Haudenosaunee. As Canada's Minister of Seniors, I'm proud to see the first bilateral agreement under the Safe Long-Term Care Fund. It's part of our commitment to work together in partnership with provinces and territories to improve the lives of seniors. Canadians living and working in long-term care should have a safe environment where they are treated with respect and dignity. Today's investments fund staffing and infrastructure upgrades to better protect people in long-term care in Newfoundland and Labrador. By helping and providing help with everyday activities for those who need it, long-term care plays a vital role in our communities. The pandemic laid bare the challenges, and Patty touched on some of those. It was heartbreaking to see the struggle in many long-term care homes for both the workers and for those living there. My own mother-in-law was in a long-term care facility when the pandemic hit, and we saw firsthand the heartbreak of the isolation and the stress that was happening to staff to try and keep seniors safe and connected with their families. It's been a really big struggle for a year and a half. But it laid bare, the pandemic laid bare, that this sector has had challenges and has struggled for many years. From the start, the Government of Canada has been a good partner with the provinces and territories while respecting their jurisdiction. We funded infection and prevention, staffing training, infrastructure upgrades, emergency support, and improvements to the retirement security of workers. And as Patty said, we did that right away because we saw where the challenges were, and we were there because Canadians step up and we work together with the provinces and territories when the challenges are there so we can meet them together. Durable improvements will take time, but an important step forward is the Health Standards Organization and Canadian Standards Association's work to develop national standards for long-term care. The HSO and CSA, their work is helping to inform our discussions with provinces and territories on the investment of $3 billion in the budget, and it will support them in ensuring that long-term care standards are applied and permanent changes are made. In the meantime, our Long-Term Care Plus program is supporting hundreds of long-term care facilities and seniors residences by providing coaching and seed funding to help them learn from each other, learn and share best practices and infection and prevention control. We've also committed to developing criminal code penalties for those who neglect seniors under their care and put them in danger. More broadly, seniors would prefer to stay in their own homes for as long as possible. So we're funding a new Age Well at Home initiative, and this initiative will fund practical support to help low-income and otherwise vulnerable seniors stay in their homes as they age. Senior serving organizations will be connecting with them to help with tasks that they no longer are able to manage, like home maintenance, daily errands, and yard work. The Government of Canada will always be there to listen and respond to the needs of seniors across the country. Today's only beginning. It's the first of many agreements that we'll be signing with the provinces and territories to continue to deliver for seniors. Thank you very much, and merci.
Labrador are the first of the provinces to sign on, and I think it shows how aligned we are with our aging at home, home first philosophies, and our desire to protect our seniors wherever they may be. And it's entirely fitting, I think, that we are here today to discuss that. The next speaker really needs no introduction. It's our Premier, the Honourable Andrew Furey, a friend and colleague from two different careers now, and he will go into some detail, I think, on the specifics of the arrangements. Sir?
Thank you, Minister. What an incredible day, although we should be probably talking about green transition and wind today. I think perhaps that would have been a better announcement. No, it's a truly wonderful day to be here and to celebrate this announcement with all of you. Minister Hajdu, it was nice to meet you in person finally. I've heard so many great things from Seamus and Dominic and others about you, and it's the country owes you a debt of gratitude. To take on the portfolio of health, something that Canadians hold near and dear, it's more than just a policy piece. It's something we're proud of around the world. When people think of the Maple Leaf, they think of healthcare. And to take that on during any time is no small task. But in the midst of a pandemic, you've shown incredible leadership, for which we're all grateful, especially as we emerge now. So thank you very much on behalf of all Newfoundlanders and Labradorians. It is truly a privilege and honor to be here, though, with Seamus and Minister Haggie and former patients even. Maybe I can use this as some credentialing hours so I don't lose my license. That would be helpful as well. But I can tell you the importance of long-term care for seniors in particular has been something that's been near and dear to my heart and has been driven home in me since medical school. I know that the population is aging here, and we know the importance of providing quality care, not just care, quality care to our seniors, especially as our population ages. We need to reflect on that as a government and ensure that we are doing everything that we can to make sure that there's quality, effective care in place for you. As you've looked after us in the past, it's now time for us to look after each and every one of you. Today's announcement is just simply incredible, and we're honored. I'm not shocked that Newfoundland and Labrador is the first. We're going to be the first of many, or the first to see the sun, and the first to see the sun on this agreement. And I'm very encouraged to hear that there's many more to follow. $15 million from the Safe Long-Term Care Fund announced today is going directly into long-term care across our beautiful province of Newfoundland and Labrador. This funding will allow us to make strategic decisions and investments to ensure those who need long-term care in Newfoundland and Labrador receive high quality and protection when required. Seniors are more than just a demographic. They're our parents, our grandparents, and more. They've looked after us, kept us safe. Now we're standing on their shoulders, and we need to look after them. This collaboration with our federal partners is a demonstration of our commitment to our seniors. This will lead to improved health and safety for residents across the province. Perhaps most importantly, this is an investment in prevention, supporting long-term care to ensure positive quality outcomes. With this funding, we will build on existing supports implemented in homes during this past year. This investment, in particular for Newfoundland and Labrador, will be used for some, but not exclusive to the following: to improve access to infection prevention and control, to purchase equipment in residential care homes, to support infrastructure upgrades, to hire much needed additional human resources. This includes infection control practitioners, a dedicated pandemic coordinator, and a provincial safe long-term care fund coordinator. Key roles, as I think we can all reflect on and appreciate now, especially during this pandemic in our system. But most importantly, I think it will allow us the flexibility to hire more frontline providers who we all know now more than ever before are the true heroes and the backbone of our system. It will allow for infrastructure upgrades for public and private facilities. It will provide for readiness assessment to be conducted in long-term care settings to prevent COVID infections and spread. I would like to thank the residents of long-term care facilities, personal care homes, and community homes, their families, and the staff. We know and recognize that COVID-19, while it's been difficult on many of us, has been extra hard on each and every one of you, often being isolated from your families and support. This is especially difficult in times of lockdown. And we appreciate, once again, the sacrifice that your generation has made time and time again, and this is just another piece of evidence towards your support and patience is very much appreciated. I also extend with much gratitude to our federal partners. And this yet again is an example of how collaboration works. When you have common goals, common outcomes, working together is what will provide the best for the citizens, not just of Newfoundland and Labrador, but indeed across the country. We certainly appreciate the hard work of the Minister and Minister Schulte, who have worked so hard, and we recognize the support that you have given us as we emerge from COVID-19. We can use examples like this to emerge to be more caring, more compassionate, and more prepared for what the future may hold. Prepared to enable and care for our seniors and most vulnerable across our great nation. Thank you, of course, to my dear friend, Minister O'Regan, whose support for the people of Newfoundland and Labrador is unwavering on this and every file. And of course, to our own Minister Haggie for leading us through the pandemic. Thank you, sir. And I notice Minister Davis is in the audience today for your tireless efforts at the cabinet table. Thank you very much. Today is another big day, a big win as we emerge from the pandemic with knowledge and lessons learned from the past, but balanced equally with hope and opportunity for the future. So thank you very much. I can't wait to see where this takes us next.
Thank you very much, Premier. And at this point, I'll call on our colleague from the federal cabinet, the representative there for Newfoundland and Labrador, who's been such a staunch advocate on this file and on various others, as we've seen in recent weeks, to say a few words. Seamus.
Thank you, John. Good morning, everyone. I can honestly say that thanks to the wind today, I have been wrapped in both flags. Physically. I want to thank the residents of St. Luke's Home, by the way, for their patience, and thank you, Marie, and to so many others who decided to show up just to see what's on the go. Appreciate it. There's a lot on the go. I just want to not lose the point that Minister Schulte, my friend Deb, is joining us from Rocky Harbour, Newfoundland. And that's where, what's that? The beautiful district of Gross Mourne, exactly. The local MHA here just reminding me. And that's in fact where our National Women's Caucus is meeting. So there's a lot of great national representation in the province today. Minister Hajdu, you got to know, pre-COVID, House of Commons, the benches are fairly small. And if you share a bench with somebody, you're about that far from being in each other's lap. I have been blessed for too short a time to have Patty Hajdu as my benchmate. And if you ever wonder what MPs and ministers are whispering to one another when you see them in the House of Commons, I will never tell you. But let me tell you that it helps when you've got a good friend to help keep you a little sane under times of great duress. I don't think Patty Hajdu knew the duress that she would confront when she became Minister of Health. I don't think any of us did. None of us saw this coming. So all I can say is I'm happy for Regatta Day, because Regatta Day gave Minister Patty Hajdu a day off. We were meant to do this yesterday. And to her long-suffering staff who suddenly found out what a weather-dependent statutory holiday is, they found out. There's nothing you could do. The only meeting I think that you could keep was the Premier, which was very generous of him. Everything else was closed. It was a holiday. So it was great. I was able to take her for a walk around Signal Hill, take her for lunch in Kitty Vitty. You did a few things in the afternoon and saw where you had dinner at my husband's restaurant in the evening, which was fantastic. You deserve a day off. And I know Regatta Day has become your new favorite weather-dependent statutory holiday in Canada. Listen, to everybody who's joining us, I just want to thank you. Today is about being there for the senior citizens of this province. From the very beginning of the pandemic, Mom and Dad and Nan and Pop have been the most at risk. The ones who raised us, who taught us how to fish, who taught us how to build businesses. So our government promised to be there for them when they needed us most, and that is what today is about. The bilateral agreement between Ottawa and our province that Minister Hajdu just announced is a game changer for seniors, for their safety and for their health. $15 million in new funding for our province. So Newfoundland and Labrador can invest in critical areas of the long-term care system, new money to hire staff, new money to retain staff, new money to improve infrastructure and do renovations like improving ventilation systems, which we now have a deep and abiding appreciation for. New money for readiness assessments, new money for improved infection control measures. This is how we build back better. This pandemic has laid bare the inequalities that have always been there in our society, and it brought to the forefront the need to improve long-term care systems right across the country. So we're taking action. We're going to improve it by investing in it, by investing in the vitality of our seniors, by investing in keeping them safe. It builds on another recent agreement signed with the province to invest $4.5 billion to expand virtual healthcare services here in Newfoundland and Labrador. It builds on the recent agreement on Muskrat Falls, $5.2 billion towards the affordability of power in this province. It builds on a recent announcement also by the Prime Minister only last week of $10 a day childcare. But this today makes it easier for people to access high quality care when and where they need it. These investments will make a real difference in the lives of our seniors, a real difference in the families of our province. Because around here, we look after one another, don't we? Don't we? Thank you all. Thanks for coming. Merci beaucoup.
Thank you very much, Seamus. It just remains for me to thank the residents of St. Luke's for allowing us into their garden for the morning. And again, we thought it was a really fitting location to have this really significant announcement of yet another collaboration between the provincial and federal governments and provincial and federal departments of health. So with that, I'm going to step aside and turn it over to Aisling to moderate any questions there may be from the media. Thank you very much.
Thank you, Minister Haggie. We will now open it up to the media question and answer period. If you could please state your name and your outlet. We'll do one question, then one follow-up, first on the ground, then over to the phone line. Please line up behind the pool mic right there. Thank you. Please go ahead.
Hi, it's Peter Jackson with The Telegram. Numerous advocacy groups, a public panel, families, all last year, they said the number one issue with long-term care is staffing. What, if anything, does this money do towards staffing of long-term care homes?
I'm sure the minister can answer this as well, but this will allow us to have flexibility to look at, we know and appreciate that staffing is the number one issue, and it's the number one issue for long-term care homes, but it also creates a backlog in the acute care setting as well. So we know and appreciate the urgency of this. This will allow us the flexibility within the pocket to look to hiring more. We know there's issues with respect to the staff that are available, and we're also committed to working with our partners to ensure that we're increasing the number of positions that are available potentially, looking at all staffing models to ensure that we know and appreciate this. And this money will allow us the flexibility we need to work within our own envelope to ensure that we're meeting the increasing staffing demands. And we really appreciate the hard work that these people have gone through. And it's going to be an issue of retention as well. And we also appreciate that. But the minister and I have a full appreciation of that and have been working with the individual groups to ensure that we're doing a full staffing review, and we'll reflect on how we can shift money around to ensure that we're meeting those demands.
Can I just add a bit? This is the first tranche of money. This is the initial $1 billion that we committed early on to start this process of federal investment in long-term care. But in budget 2020, there's an additional $3 billion. And the provinces and territories have highlighted staffing and retention as one key area, and the other key area, the enforcement of standards. And so those new negotiations are about to begin on the next tranche of money. And my idea as Minister of Health and our federal government's perspective is that the provinces and territories are the ones delivering. So they do know what they need. We just need to sort of agree in general on how we're going to measure how that money works out. And this province is very committed to ensuring that they have quality staffing that allows for people to stay in those positions as well. Thank you.
Thank you. And the other question is, infection control was obviously a much bigger issue in Ontario and Quebec than it was here. Is this money specifically earmarked for infection control, or is that a provincial decision?
It's a good question. Certainly from the federal government's point of view, they gave us fairly broad outlines and broad headings. So the Premier referenced some specific roles around infection prevention and control that we will look at on a provincial basis. I think what we have learned is that good old-fashioned public health measures work. We just simply need to make sure that the standards around that are consistent. We have a slightly different arrangement here than other jurisdictions. So our long-term care facilities, for those with the highest acuity, are actually regional health authority run, and they fall under various acts and legislation. But the private sector operates the personal care homes, and we have a very active review of those standards in place. And I think the extra personnel here will be able to provide support for those businesses in making sure they meet the new standards that we're going to have to deal with now with COVID, where perhaps we didn't before. And we really don't know how long those changes that relate to COVID are going to last. But certainly, as Premier referenced, prevention is important. So again, that education and that monitoring, this money will help us do that.
Next question, please.
Hi there, Ben Cleary, NTV News. I have a pretty general question for Minister Haggie. And just what are the other issues here in this province for long-term care that you think this $15 million needs to go towards right away?
We have some significant ailing infrastructure in the sense that it is old. I mean, in Gander, for example, the long-term care facility there was built in the 70s, similarly out around New West Valley, and that's not unusual. You've seen how the new facilities have state-of-the-art air handling and HVAC and these kind of things. So one of the things we're looking at is upgrading those in the light of recommendations from Infection Prevention and Control to make sure that the older facilities have the same ability to handle air in maybe smaller rooms or multi-occupancy rooms compared with, say, the new ones in Pleasant View Towers or in the Corner Brook facility. So AC, HVAC, windows have been an issue in some places as well. So there's a significant infrastructure deficit there that this money will go a considerable way to address. There are other examples around cleaning practices and these kind of things, but they're a little bit more granular, and in general, that would be left to IPAC, Infection Prevention and Control, locally, with provincial coordination through the positions the Premier's referenced to deal with. So we'll have no trouble spending this at all.
No follow-up? Okay. Thank you.
Hi, Noah Shepard with VOCM News. It was mentioned in the earlier remarks, the moms, the dads, the nans and pops. What can they expect to see improved in their day-to-day life in facilities like this?
Two doctors fighting over a mic. No, I mean, they can expect to see, I think we all recognize, to follow up on a previous answer, the importance of staffing, and when it comes to the extra pressure that's being put on these long-term care facilities. I mean, it's not a secret. The demographics suggest it's all open that there'll be more pressure on the current system. So we're trying to support the current system and plan for the future, recognizing that there will be increased pressure on the system, and ensuring that the quality care that all residents should be and have to be used to is afforded for into the future. So that's what's really, I think that residents in particular, on a day-to-day basis, hopefully they'll see an increase in infection control and more presence there, although I think we're probably doing a really good job, as evident in our numbers currently. But that'll become a part of normal life, and this will be supported in this funding. But in addition to that, into the future, this will allow us to plan, as we do know that our population is aging, and making sure that we have the quality support that patients across our province are used to.
It was mentioned earlier, the loneliness factor. How is something like that going to be improved with this money?
I think one of the remedies around the loneliness factor has been around visiting, and I think some of the changes here with the money that were being provided by the feds will help deal with that. Because if you can deal with infection prevention and control, if you can have air conditioning in areas that don't currently have it, you can actually comfortably fit visitors from the appropriate family bubble into people's rooms. So I think the other issue is around wheelchair accessibility in older personal care homes, putting wave buttons on the doors instead of push buttons for those people who have significant mobility challenges but may be able to get around. It's going to be those little things. But the loneliness piece is also part of another discussion I had quite recently, for example, in Botwood, around how to engage youth in terms of linking with seniors whose families may be away. So they do have regular visitors. and it doesn't just rely on, staff and having the time to interact one-on-one. They get stimulation. The students find it great. These kind of things have been tried in Ontario with great success, and in Montreal. We've done them here locally on a more ad hoc basis, but I'd love to see those kind of things develop, and maybe a little bit of seed money to help with community groups in age-friendly communities would also help that, to have people who are retired but would like to meet up with older folk and just spend an hour or two with them. So it's going to be at a very, very small level. A little bit of money there may go an awful long way. So the imagination is your limit.
I'm not sure if I can be heard.
Thank you. We will now take questions from the phone. Mark, operator, over to you.
It's okay. I think
Hello.
you muted me.
We'll now take some questions online with Zoom. If you are a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I've stated it, please indicate your name and media outlet before posing your question. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et à un suivi. Sauf si je l'ai déjà dit, veuillez indiquer votre nom et votre média avant de poser votre question, s'il vous plaît. Our first question comes from Tessie Sansi with the Hill Times. Please go ahead, Tessie.
Thank you and good morning. I will target my questions to the federal ministers. So to clarify, this fund is separate from the federal government's promise of national standards. And therefore, just because a province has agreed to sign up for the long-term care fund, it doesn't mean they've agreed to sign up for national standards. So I'd like that clarification, please. And also, why not tie this fund to national standards?
Thank you very much, Tessie. I appreciate the question. And I will start and maybe turn over to Deb to say a few words as well, Minister Schulte. This initial tranche of money is about getting money into provinces and territories quickly to be able to do those really rapid changes like Minister Haggie and the Premier has spoken about that will ensure that seniors are safer as soon as possible. The $3 billion in 2020 is the beginning of the national standards work. And the provinces and territories are working with the federal government right now to negotiate what that fund will look like and how we have that shared set of standards. Finally, I'll just say this. It'll be important for provinces and territories to commit to the enforcement of those shared standards. We know that in some provinces there were standards. And yet we still saw tremendous tragedy. So it's not enough to have those standards. There has to be a process to monitor them and to also make sure that there is accountability for the various people responsible for implementing them. Deb, did you want to say a few words?
Thank you. Thank you very much. I'm not sure if I could be heard, but yes, I just wanted to build on what Minister Hajdu has just said. This is a journey that we are on with provinces and territories, and it started right back in the early days of the pandemic with the funding that we provided to support infection prevention control, PPE, wage supplement to try and address the issues that we could see right away were occurring in the long-term care sector and in the health sector. So it's a journey. This is just another opportunity with the $1 billion safe long-term care where you can focus on infection prevention. And as Minister Hajdu has said, the standards, provinces had standards. It's very much a matter of making sure we have the workforce to do the work that needs to be done, to make sure that they have the equipment they need, and then to make sure that we enforce those standards, because that was where we were seeing some challenges in certain provinces. So I just want to say it's a journey, and this is an earlier fall economic statement, an announcement, and we're building on that work. You can be sure those conversations are underway. Thank you.
Okay. I'll jump in with my follow-up then. It's very likely that we are going into a federal election. People are just waiting for the call. In terms of both ministers have alluded to conversations that are ongoing with provinces and territories. Do those conversations stop if we go into an election, or can the bureaucracies keep those conversations going with provinces and territories?
Thank you for the question. And yes, the officials are working together constantly. In fact, probably more closely than they ever have before on not just this issue, long-term care, but many other issues related to COVID. And of course, our chief medical officers of health are regularly communicating and have their own special advisory committee where they work together to try and ensure that we have some consensus as we go forward. That work will continue, regardless of whether there is an election or not. Those officials have been working incredibly closely together, and I do want to take a moment to thank them all, because in fact, they're the ones that do the hard work and make sure that we're looped in so that we can provide the appropriate approvals.
Thank you. Operator, do we have another question on the phone?
No more on the phone at this time. Thanks.
Wonderful. I'll ask folks to queue up here.
Bonjour, Madame la Ministre. Patrick Bowler with Radio-Canada. Question, first of all, relating to a letter you wrote where you supported the Canadian Pediatric Society's position that Alberta's reversal of health measures related to the pandemic was unnecessary and a risky gamble. Should places like Newfoundland and Labrador, like Atlantic Canada, which have been relatively safe during the pandemic, worry about what we're seeing in Alberta right now, in your opinion?
Well, maybe I'll start and turn to Dr. Haggie, because of course we are one country. And, you know, just on my flight here, my seatmate was someone that was actually returning from Alberta and worked in Alberta, but lives in Newfoundland. And that just is an illustration of how Canada really is just one country. I want to thank the medical officers of health who've worked so hard to try and align what we're doing, but we do know that provinces and territories choose different paths. I think that any deviation from tracking this virus, monitoring this virus, isolating sick people is a mistake at this particular time. Certainly that's the advice of the public health officials that advise me, that despite our growing vaccination rates, we want to continue to protect the people that can't be vaccinated. And that's why the Pediatric Association is so vocal. In fact, 3 million children in Canada are not eligible for vaccination yet. There isn't a vaccine that's approved as of yet for use in children. And of course, there's others that are not vaccinated for a variety of reasons. And so I think it's in all of our interests that no one region of Canada loses control of COVID-19. And I'll turn to Dr. Haggie, because he and I were speaking about the unpredictability of COVID-19 this morning at breakfast.
Thank you. Yes, certainly masks and testing, tracing and isolating are active topics within the department. I would encourage you to attend our 2 o'clock COVID briefing and ask Dr. Fitzgerald those very questions.
Second question for Mr. O'Regan, related to St. Pierre-Miquelon. St. Pierre-Miquelon says that it's still waiting for a formal go-ahead from the federal government in order to be able to have a ferry service when the border reopens on Monday. You're the federal minister for Newfoundland and Labrador. Is this coming? Is this going to be in place by Monday, to your knowledge? And what would you say to people in St. Pierre who are, you know, chomping at the bit really to get across the border?
I am perhaps the least qualified person on this stage to answer that question, but I appreciate you're raising it with me. I understand, Patrick, because it has been raised to me before, and it's certainly something that I have brought to the attention of my federal colleagues, and I know it's something that I have been talking to the Premier and to the Minister about. So if they'd like to add anything to it right now, I'll defer to them. Do you want to speak to it? Yeah.
I'll just speak in general about the principles of opening up and admitting non-Canadians, foreign nationals to Canada. And we know that there are places like St. Pierre-Miquelon, but also places like Delta, BC, a lot of places that rely actually on a shared resources, community resources for a variety of different reasons. But we've been really clear that as we adjust our border measures, it will be for fully vaccinated individuals only. And so those conversations are still happening about St. Pierre-Miquelon, But rest assured that for us, the focus is on any measures that are released at the border being done with the full advice of our public health officers. And we, as I said, at this point are comfortable with a process that allows some easing of measures for fully vaccinated travelers from other countries. And first the United States, as you know, and then other countries potentially a month away. Still maintaining the pre-departure tests so that we can test for anybody that's had a breakthrough infection prior to departure, and then randomized mandatory testing upon arrival. But we also know that we may have to adjust quickly if we see changes in infectivity rates at the border, if there are new challenges or new variants that are growing in concern. There are a number of different metrics that Dr. Tam watches very closely. And of course, we won't hesitate to change course if we need to.
Alrighty, if there are no further questions, operator, do we have any questions on the phone?
No more on the phone, thanks.
Wonderful. Well then, in that case, thank you everybody for attending this event. We will now be closing the line. Thank you.
Yeah, good job. Yay.
Thank you, everyone. Bye-bye.